Hi everybody, today I'm going to be presenting on mucormycosis, in particular the histopathology of this infection. So first off, a little bit of background. Mucormycosis is commonly seen in immunocompromised patients, and it's also seen in people with diabetes because diabetic ketoacidosis can actually cause a release of iron from ferritin, which helps with enhanced fungal growth of mucor, the fungus that causes this infection. Um, Once mucor is in your system, it particularly likes to invade and proliferate inside of blood vessels. So once it gets into the blood vessels in your nose, it can or your eye, it can quickly go to the cavernous sinus and proliferate very quickly and invade through the cribriform plate and cause necrosis of the bones in the or of your cribriform plate and can cause frontal abscesses in your brain, or it can invade out towards the skin and cause perinasal and periorbital necrosis, which you can see on the right. This person with the characteristic black eschar of that nasal and orbital necrosis. Um, from time of infection to time of death, that can be as short as 2 weeks. So really, the only option is emergency, immediate surgical debridement of the infected areas and treatment afterwards with amphotericin B, which is an antifungal. So as far as histopathology goes, I think it's most helpful to compare Mucor to Aspergillus because they can look very similar under a light microscope, but there are some key differences that can help differentiate the two. In particular, Aspergillus is going to have much thinner hyphae, and Mucor is going to have thicker hyphae. Aspergillus is going to have septations within the hyphae, where Mucor is going to have a lack of those septations. And then I really think the key differentiating factor is the branching. So with Aspergillus, you're going to have these pretty regular acute angle branches at about 30 degrees. Whereas with Mucor, it's more irregular. The branches are usually going to be at more than 40 degrees and even has these characteristic 90-degree branches of the hyphae. So they can look really similar at first, but it's actually pretty easy to tell them apart. Again, just another kind of set of pictures to help compare and contrast. Here we can really appreciate the differences in the thickness of the hyphae, with Aspergillus having thinner hyphae, in the lack of septations in Mucor and the abundance of septations in the Aspergillus. That's all I have. Thanks for listening.